embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters, each approximately 3 months long. Throughout pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. Pregnancy weeks 5-8. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester pregnancy weeks 14 to 17. Many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice swallowing and can even suck its thumb. Pregnancy weeks 18-22. The baby experiences a substantial growth spurt with an increase in size and weight. The baby's senses continue to develop, and it can now hear sounds from the outside world. The skeleton continues to develop, and the bone marrow produces red blood cells. A waxy substance starts to form on the baby's skin to protect it in the amniotic fluid. Pregnancy weeks 23-27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester pregnancy weeks 28-31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32-35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organ systems further mature and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36-40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process.
Teen pregnancy can have significant physical and emotional health risks for both the mother and the baby. Teenage mothers are at a higher risk of experiencing complications during pregnancy and childbirth, such as premature birth, low birth weight, and preeclampsia. These complications can have long-term health effects for both the mother and the baby, such as developmental delays, chronic health conditions, and even death. Furthermore, teenage mothers may experience emotional and mental health issues during and after pregnancy. It's important to educate young people about safe sex practices and contraception to prevent unintended pregnancies. Providing comprehensive sex education that includes information about contraception and healthy relationships can help young people make informed decisions about their sexual health. It's also important to provide access to affordable and effective contraception options for teens who choose to be sexually active. Teen pregnancy can have significant physical and emotional health risks, but with education and resources, we can help prevent unintended pregnancies and support pregnant teens in maintaining their health. Thanks for watching. Don't forget to like and subscribe for more videos like this.
Title: How to Check a Pregnancy Test, a Comprehensive Guide. 1. Introduction. Welcome to our guide on how to check a pregnancy test accurately. 2. Importance of timing. Timing is crucial for accurate results. Discuss when to take the test for the best outcome. 3. Understanding pregnancy tests. Explain the types of pregnancy tests available, urine tests, and blood tests. 4. Choosing the right test. Guide viewers on selecting a reliable pregnancy test kit. 5. Reading the instructions. Emphasize the importance of thoroughly reading the instructions before starting the test. 6. Gathering supplies. List the necessary items needed for taking the test. 7. Collecting urine sample. Offer tips on how to collect a urine sample properly for the test. 8. Performing the test. Step-by-step demonstration on how to perform the test accurately. 9. Waiting period. Explain the waiting period before checking the results and why it's essential. 10. Interpreting results. Provide guidance on interpreting the results correctly, including what different symbols or lines mean. 11. False positives and negatives. Address factors that could lead to false positive or negative results. 12. Next steps. Discuss what to do after getting the results, whether positive or negative. 13. Seeking medical advice. Highlight the importance of consulting a healthcare professional for confirmation and further guidance. 14. Emotional support. Offer reassurance and support for viewers, acknowledging the emotional impact of pregnancy test results. 15. FAQs. Answer common questions about pregnancy tests, addressing concerns and misconceptions. 16. Tips for accuracy. Provide additional tips to ensure accurate results, such as testing in the morning and avoiding certain medications. 17. Handling results. Discuss how to cope with different outcomes and offer resources for support. 18. Partner involvement. Encourage involving partners in the testing process and decision-making. 19. Test disposal. Guide viewers on proper disposal of used pregnancy tests. 20. Conclusion. Summarize key points, reiterate the importance of accuracy, and offer encouragement to viewers.
Introduction. Greet your viewers warmly. Briefly share your excitement about documenting your pregnancy journey. Week 4-6, Discovery. Discuss how you found out about the pregnancy. Share your initial thoughts and emotions. Week 7-10, First trimester symptoms. Detail common symptoms like morning sickness and fatigue. Offer tips on coping with these symptoms. Week 11-13, First ultrasound. Share your experience with the first ultrasound. Discuss any surprises or emotions during this appointment. Week 14-16, Gender reveal. If you've discovered the gender, reveal it to your audience. Share any creative or special gender reveal ideas you used. Week 17-20, Second trimester milestones. Discuss improvements in symptoms. Share any notable milestones, like feeling the first kicks. Week 21-24, Maternity Fashion. Showcase your favorite maternity outfits. Offer tips for staying stylish and comfortable. Week 25-28, Baby Shower Preparation. Discuss planning and organizing your baby shower. Share any memorable moments from the celebration. Week 29-32, Third Trimester Challenges. Address common challenges like back pain and sleep difficulties. Offer advice on staying comfortable during this stage. Week 33-36, Nesting and Preparing. Show your audience how you're preparing for the baby's arrival. Discuss any nesting instincts or rituals you've experienced. Week 37-40, Final Countdown. Share your thoughts and emotions as you approach your due date. Discuss any last-minute preparations or anxieties. Labor and delivery. Document your labor experience as much as you're comfortable. Share your feelings and reactions during the delivery. Welcome baby, postpartum. Introduce your newborn to your audience. Discuss your postpartum experiences and emotions. Conclusion. Express gratitude to your viewers for joining you on this journey. Share your plans for future videos or updates on your growing family.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours. Or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping.
Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantyliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Welcome back to our channel. Today, we're diving into a topic that many of you have requested, the early signs of pregnancy. Whether you're trying to conceive or just curious, these symptoms could be indicators of an exciting. Point 1. Missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2. Breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Fast track to fertility, expert tips from a leading doctor. 1. Introduction. Welcome viewers. Today we're sharing the top 20 tips to boost fertility and increase your chances of getting pregnant fast. 2. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet and regular exercise to support overall well-being. 3. Nutrient-rich foods. Focus on nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins to enhance fertility. 4. Hydration. Stay well hydrated by drinking plenty of water, promoting optimal reproductive health. 5. Limit caffeine and alcohol. Reduce caffeine and alcohol intake, as excessive consumption can impact fertility. 6. Maintain a healthy weight. Achieve and maintain a healthy weight, as both underweight and overweight conditions can affect fertility. 7. Regular exercise. Engage in regular moderate exercise, which can positively influence reproductive health. 8. Balanced hormones. Ensure hormonal balance through a healthy lifestyle and, if needed, consult with a doctor for guidance. 9. Quit smoking. Quit smoking as it has detrimental effects on fertility and reproductive organs. 10.
Stress management. Practice stress management techniques such as meditation, yoga, or deep breathing to reduce stress levels. 11. Regular checkups. Schedule regular checkups with a fertility specialist to monitor reproductive health. 12. Know your cycle. Understand your menstrual cycle to identify your most fertile days and optimize conception timing. 13. Tracking ovulation. Use ovulation prediction kits or apps to track ovulation accurately for better timing. 14. Position matters. Experiment with different sexual positions to increase the chances of sperm reaching the egg. 15. Optimal timing. Be consistent with intercourse during the fertile window to maximize the chance of conception. 16. Sperm health. Encourage sperm health by avoiding hot tubs, tight underwear, and excessive heat exposure. 17. Preconception supplements. Consider taking preconception supplements like folic acid to support a healthy pregnancy. 18. Limit exposure to harmful substances. Minimize exposure to environmental toxins and chemicals that may affect fertility. 19. Fertility-friendly lubricants. Use fertility-friendly lubricants that do not hinder sperm movement. 20. Patience and emotional support. Be patient and seek emotional support during the fertility journey, understanding that it may take time. Conclusion. Thank you for watching. Implementing these tips can significantly boost your chances of getting pregnant fast. Remember, consulting with a fertility specialist is crucial for personalized advice.
Pregnancy week 1 to 2. 1 and 2 weeks pregnant. Congratulations! During the first and second week of pregnancy, your body is preparing for possible conception. How is pregnancy calculated? Calculating the day your baby begins to develop and keeping track of your pregnancy dates can be a challenge. The development of pregnancy is counted from the first day of the woman's last normal menstrual period, LMP, even though the development of the fetus does not begin until conception, which is about 2 weeks later. Pregnancy is calculated from this day because each time a woman has a period, her body is preparing for pregnancy. Counting from the LMP, most women are pregnant an average of 280 days. Calculating from the LMP also gives a standard of measurement for healthcare providers to follow, since it is extremely difficult to know exactly when conception occurred. For more information on how pregnancy is measured, please see our information on calculating your dates.
What changes are occurring with your body? Your period has just begun, and you may be thinking about becoming pregnant. Your ovulation time is the most important thing you need to understand when trying to conceive. Ovulation occurs when a mature egg is released from the ovary, pushed down the fallopian tube, and available to be fertilized. The lining of the uterus has thickened to prepare for a fertilized egg. If conception does not occur, the uterine lining will be shed. The shedding of an unfertilized egg and the uterine wall occurs during menstruation. There are also several facts that you need to know concerning ovulation. An egg lives 12 to 24 hours after leaving the ovary. Normally, only one egg is released each time you ovulate. Ovulation can be affected by stress, illness, travel, and significant changes in weight, exercise, and sleeping patterns. Some women may experience light spotting during ovulation. This is not considered to be an actual period, but rather an ovulatory bleeding. What is happening with your baby? Nothing is happening yet, but be patient while the stage is being set. Before long, an egg will be released and will be available to be fertilized. How do you track ovulation? A woman's monthly cycle is measured from the first day of her menstrual period until the first day of her next period. On average, a woman's cycle normally is between 28 to 32 days. Ovulation is calculated by starting with the first day of the cycle, which is the day the menstrual period begins. Most women ovulate on any one day between day 11, day 21 of their cycle. This is what many refer to as the fertile time or fertility window of a woman's cycle because sexual intercourse during this time increases the chance of pregnancy. For more information on tracking ovulation, please see Fertility Awareness, Understanding Ovulation, Ovulation Calendar. What should you plan at this time?
There may need to be some lifestyle changes made at this time to increase your chances of conceiving and having a healthy baby down the road. Adequate exercise and a balanced diet are important factors to evaluate. It is recommended to begin taking prenatal vitamins and stop using substances such as caffeine, artificial sweeteners, alcohol, recreational drugs, nicotine. If you are taking prescription drugs, check with your healthcare provider to see if such medication is safe to take during pregnancy. For more information on nutrition during pregnancy, please see our information on preconception nutrition. Tips for making your pregnancy better. The most important thing you can do right now is to act in the way you would if you already knew you were pregnant. Since it can be weeks before you know if conception has occurred, this will protect both you and your future baby from any substances or activities that could cause problems.
3 weeks pregnant. Sperm met egg last week, and voila, you've made a baby. It's so early that when you're 3 weeks pregnant, you may have no idea that you're actually pregnant. Conception just happened a few days ago, and there probably hasn't been time for you to miss a period yet at week 3 of pregnancy. Can you tell you're pregnant at 3 weeks? While some people feel no difference at all at this early stage, others may start to notice 3 weeks pregnant symptoms. The experience at 3 weeks pregnant can really vary, so don't fret if you don't feel anything out of the ordinary. However, if you feel nauseous and your breasts are sore, that's normal too. Everything changes quickly in early pregnancy, so no matter how you feel, be prepared to feel different in a week. 3 weeks pregnant symptoms. When you're 3 weeks pregnant, symptoms may not have appeared yet. That's because most early pregnancy symptoms are caused by pregnancy hormones. Spotting as the fertilized egg burrows into the lining of your uterus. Nausea. As the pregnancy hormone HCG begins to make its way through your newly pregnant body, you may notice some feelings of queasiness, or nausea so bad it makes you puke. Morning sickness should really be called all-day sickness since it doesn't discriminate by time of day. If you're feeling this symptom of pregnancy at 3 weeks, you may be further along than you thought. Or you may even be 3 weeks pregnant with twins. That's because twin moms-to-be often have higher levels of pregnancy hormones and therefore worse nausea. Breast changes. Your breasts can start to get sore and your nipples may darken as your body starts prepping to make milk. Missed period. If your cycle is typically shorter than 28 days, you may realize toward the end of this week that you could be pregnant. The only way to know for sure is to take a pregnancy test. Positive home pregnancy test. Check the box of your home pregnancy test to see how accurate its results are before your missed period. Most are over 99% accurate once you've missed it, and some brands promise to detect pregnancy hormones in your urine sooner than that. For example, when you're 3 weeks 5 days pregnant or even 3 weeks 4 days pregnant. Here's the thing, the amount of pregnancy hormone HCG in your body might not be enough for the test to detect right away, but it doubles every 48 hours. If you get a negative result, follow up a few days and then a week later with another pregnancy test and then another, to be sure it wasn't just too early to tell. Positive blood pregnancy test. In some cases, like if you're at risk for miscarriage or ectopic pregnancy, your doctor may ask you to come into the office for a blood draw. Blood tests can detect smaller amounts of HCG than urine tests can, so you may find out that you're pregnant. 3 weeks, pregnant belly. A belly isn't really a thing. Though you may feel a bit bloated, most pregnant women don't start to show until around week 12 or later. Before you start eating for 2, know that doctors only recommend most women gain 1 to 5 pounds total in the first trimester, that's the first 13 weeks. So you definitely don't have license to start indulging at 3 weeks pregnant. In fact, try to eat a healthy, well-rounded diet and to take a daily prenatal vitamin with at least 400 micrograms of folic acid in it. Doctors don't recommend increasing your daily calorie intake until the second trimester. Once you hit week 14, you'll want to add about 300 calories per day.
During week 4, the tiny life you and your partner created just a week ago is implanting and settling into its new home in your uterus, where it will grow and develop over the next 36 weeks. Along with implantation, comes a rise in the pregnancy hormone HCG. At the end of this week, there may be enough HCG to detect with a sensitive early home pregnancy test. First, what is your baby's due date? Your baby's development at 4 weeks. Starting at week 4, your baby is called an embryo. At just 0.2 millimeters, your little embryo is about the size of a poppy seed. Implantation. When the fertilized egg is in the uterus and attaches to the uterine wall, it is called implantation. Implantation usually takes place 6 to 10 days after ovulation. So, if it didn't happen at the end of week 3, your budding baby will burrow into your uterine lining this week. Early development. There inside your fertilized egg are all the cells that will develop into your baby and what your baby needs to survive for the next 9 months. The inner cells begin to transform into your baby's organs and body parts. The outer cells start to form the placenta. You and your baby at 4 weeks pregnant. Your baby at 4 weeks. In weeks 4 to 5 of early pregnancy, the embryo grows and develops within the lining of your womb. The outer cells reach out to form links with your blood supply. The inner cells form into 2, and then later into 3 layers. Each of these layers will grow to be different parts of your baby's body. The inner layer becomes the breathing and digestive systems, including the lungs, stomach, gut, and bladder. The middle layer becomes the heart, blood vessels, muscles, and bones. The outer layer becomes the brain and nervous system, the eye lenses, tooth enamel, skin, and nails. In these early weeks of pregnancy, the embryo is attached to a tiny yolk sac that provides nourishment. A few weeks later, the placenta will be fully formed and take over the transfer of nutrients to the embryo. The embryo is surrounded by fluid inside the amniotic sac. It's the outer layer of this sac that develops into the placenta. Cells from the placenta grow deep into the wall of the womb, establishing a rich blood supply. This ensures the baby receives all the oxygen and nutrients it needs. You at 4 weeks. Conception usually takes place about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing you may notice is that your period does not arrive, or you may have other signs and symptoms of pregnancy, such as breast tenderness. You can confirm the pregnancy with a pregnancy test.
5 weeks pregnant symptoms. Pregnancy symptoms are unique and unpredictable. 2 people can each have healthy pregnancies without any of the same symptoms. Likewise, you may have bad nausea in your first pregnancy, but no morning sickness in a later pregnancy. The swiftly rising levels of the hormones human chorionic gonadotropin, HCG, and progesterone are responsible for many of the pregnancy symptoms you experience. You can expect any of the following week 5 pregnancy symptoms. 1. Morning sickness. Don't be fooled by the word morning. Nausea and vomiting can happen at any time during the day. While morning sickness typically begins during week 6 of pregnancy, some people experience it earlier. Eating several small meals throughout the day, instead of 2 or 3 big meals, may help to relieve these symptoms. Call your doctor if you can't keep any food or liquid down. This may be a sign of hyperemesis gravidarum, which is a rare disorder that involves continual nausea and vomiting during pregnancy. It sometimes requires inpatient treatment at a hospital. 2. Lightheadedness. Your blood pressure tends to run lower than usual during pregnancy. This can cause dizziness and even fainting. If you feel dizzy, sit down if you're standing or pull over if you're driving. 3. Frequent urination. As your uterus expands, it can press against your bladder. This will likely cause you to need to urinate more frequently. Go when you have the urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, Always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. You may experience tender, sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy. 9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Vaginal discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spotting and may contain clots. Abdominal or pelvic cramps. Back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubulid pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The 5th week of pregnancy marks the start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only 1 baby at a later ultrasound. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry. 7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavy or bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours. Or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too. 9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born. "10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born. 11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And, if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress, and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy, greasier, spotty skin, thicker and shinier hair, bloating and the feeling of being bloated.
Hello everyone, welcome back to our channel. Today, we are going to discuss the early signs of labor that expectant mothers should be aware of. If you're new here, consider subscribing and hit that notification bell so you won't miss any updates. Let us get started. The first sign is lightening. This occurs when the baby drops lower into the pelvis, relieving pressure on the diaphragm. Moms-to-be might feel increased pelvic pressure and notice their baby bump is lower. Braxton Hicks contractions. Next up, Braxton Hicks contractions. These are irregular, painless contractions that help prepare the uterus for labor. They may feel like a tightening or hardening of the belly. Increased discharge. As labor approaches, you might experience increased vaginal discharge. This is known as the mucus plug, and it protects the cervix during pregnancy. Losing it is a sign that labor could be near. Nesting instinct, feeling an uncontrollable urge to clean and organize that's the nesting instinct kicking in. Many expectant mothers experience this surge of energy right before labor. Diarrhea or nausea, hormonal changes can lead to gastrointestinal changes too. Diarrhea or nausea might occur as your body prepares for labor. Back pain, persistent lower back pain can be a sign of labor, as the baby's head presses down on the pelvis and sacrum. Rupture of membranes, when the amniotic sac ruptures, commonly known as the water breaking, it's a clear indication that labor is imminent. This might be a gush of fluid or a slow trickle. Contractions, last but not least, true labor contractions. These are regular, progressively intensifying contractions that help the cervix dilate and efface. Conclusion: remember, every pregnancy is different, and not all women will experience these signs in the same way or order. If you notice any of these signs or have concerns, always reach out to your healthcare provider. Stay tuned for more pregnancy-related content and take care. See you in the next video. Outro. Thank you for watching. If you found this video helpful, give it a thumbs up and share it with others. Don't forget to subscribe and hit the notification bell to be notified of our future videos. Stay safe and take care. Bye. Welcome back to our channel, where we provide valuable information and support for those on their journey from infertility to fertility. Today, we'll be discussing the step-by-step process of transitioning from infertility to achieving a successful pregnancy. If you're new here, don't forget to hit the subscribe button and the notification bell so you won't miss any of our informative videos. Let us dive right into it. Step 1. Seeking professional help. The first crucial step in the journey is seeking professional help. Consult a reproductive endocrinologist or fertility specialist to evaluate your medical history, conduct tests, and diagnose any underlying issues causing infertility. Step 2. Diagnosis and treatment plan. Once diagnosed, your fertility specialist will create a personalized treatment plan. This may include lifestyle changes, medications, or advanced assisted reproductive technologies like in vitro fertilization (IVF), intrauterine insemination (IUI), or egg freezing. Step 3. Lifestyle and dietary changes. Making positive lifestyle changes can significantly impact your fertility. Maintain a healthy weight, exercise regularly, and consume a balanced diet rich in vitamins, minerals, and antioxidants. Reducing stress through activities like yoga or meditation can also be beneficial. Step 4. Medications and hormonal therapy. In some cases, hormonal imbalances may be causing infertility. Your specialist might prescribe medications to regulate your hormones and improve your chances of conception. Step 5. Assisted reproductive technologies (ART). When other methods aren't successful, you may explore assisted reproductive technologies such as IVF. This involves fertilizing eggs with sperm in a laboratory and transferring the resulting embryos into the uterus. Step 6. Egg or sperm donation. If needed, you may consider using donated eggs or sperm. This option is often chosen when a partner has low-quality eggs or sperm or in cases of same-sex couples. Step 7. Surrogacy. Surrogacy is another option for individuals or couples who can't carry a pregnancy themselves. A surrogate mother carries the pregnancy on behalf of the intended parents. Step 8. Adoption. If achieving a biological pregnancy isn't possible, adoption is a wonderful way to build a family. Adoption agencies can help match you with a child, and the process varies by country and jurisdiction. Step 9. Emotional support. Throughout this journey, emotional support is essential. Consider joining support groups, seeking therapy, or confiding in close friends and family members who can provide comfort and understanding. Step 10. Patience and persistence. Remember, the path from infertility to fertility can be challenging, but staying patient and persistent is key. Celebrate small victories, lean on your support network, and never lose hope. Conclusion. Host. That wraps up our step-by-step guide on transitioning from infertility to fertility. We hope you found this information helpful and encouraging. If you have any questions or would like us to cover specific topics in the future, please leave a comment below. Don't forget to give this video a thumbs up and share it with anyone who might benefit. Thank you for watching, and we'll see you in the next video. Stay strong and keep believing in the
Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and monitoring of PCOS symptoms. Encourage open communication with healthcare providers. 11. Stress management. Discuss the impact of stress on PCOS symptoms. Suggest stress reduction techniques such as meditation and yoga. 12. Sleep hygiene. Highlight the importance of adequate sleep for overall health. Discuss the link between PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one size fits all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Address the potential impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information.
Title: 27 Foods to Avoid During Pregnancy. Introduction. Welcome back to our channel. Today, we're discussing crucial information for expectant mothers. If you're pregnant or planning to be, it's essential to be mindful of your diet for a healthy pregnancy. Point 1. Raw seafood. Raw seafood, like sushi and oysters, can pose a risk of contamination with harmful bacteria or parasites. Opt for fully cooked options. Point 2. High mercury fish. Avoid high mercury fish, such as shark, swordfish, king mackerel, and tilefish. Mercury can harm the developing nervous system of the fetus. Point 3. Undercooked eggs. Ensure that eggs are fully cooked to avoid the risk of salmonella infection. Point 4. Raw or undercooked meat. Raw or undercooked meat may harbor bacteria or parasites. Cook meat thoroughly to eliminate these risks. Point 5. Unpasteurized dairy. Unpasteurized dairy products can contain harmful bacteria like Listeria. Stick to pasteurized options for safety. Point 6. Excessive caffeine. Limit caffeine intake to avoid potential complications. Opt for decaffeinated beverages when possible. Point 7. High sugar and processed foods. Excess sugar and processed foods contribute to unnecessary weight gain. Focus on whole, nutrient-rich options. Point 8. Unwashed produce. Ensure thorough washing of fruits and vegetables to eliminate any potential contaminants. Point 9. Alcohol. Alcohol can cause developmental issues, so it's best to abstain during pregnancy. Point 10. Artificial sweeteners. Some artificial sweeteners may have uncertain effects during pregnancy. Choose natural sweeteners in moderation. Point 11. Deli meats. Deli meats may carry the risk of listeria contamination. Heat them thoroughly before consumption. Point 12. Soft cheeses. Avoid soft cheeses like feta, brie, and blue cheese, as they may harbor harmful bacteria. Point 13. Excessive vitamin A. High doses of vitamin A found in some supplements and liver can be harmful during pregnancy. Point 14. Raw sprouts may carry a risk of contamination, so it's advisable to avoid them. Point 15. Unwashed hands and surfaces. Practicing good hygiene, including washing hands and surfaces, helps prevent foodborne illnesses. Point 16. Excessive salt. High salt intake can contribute to fluid retention. Opt for balanced sodium levels. Point 17. Herbal teas. Some herbal teas may have adverse effects during pregnancy. Consult with your healthcare provider before consumption. Point 18. Excessive intake of vitamins and minerals. Avoid excessive intake of certain vitamins and minerals, as it may lead to complications. Point 19. Excessively hot baths. Hot baths can raise your body temperature, potentially harming the developing fetus. Stick to warm or lukewarm baths. Point 20. Raw cookie dough. Raw cookie dough may contain raw eggs, posing a risk of salmonella. Bake cookies thoroughly. Point 21. Unwashed lettuce. Ensure lettuce and other leafy greens are thoroughly washed to remove potential contaminants. Point 22. Excessive tuna. While fish is beneficial, too much tuna can lead to excessive mercury intake. Choose low mercury options. Point 23. Processed junk food. High in additives and preservatives, processed junk food should be limited for a healthy pregnancy. Point 24. Excessive exercise. While staying active is essential, avoid excessive or high-impact exercise without consulting your healthcare provider. Point 25. Certain medications. Always consult your doctor before taking any medications during pregnancy. Point 26. Smoking. Smoking poses severe risks during pregnancy. Quitting is the best option for the health of you and your baby. Conclusion. Remember, a healthy diet and lifestyle are crucial during pregnancy. Consult with your healthcare provider for personalized advice. If you found this information helpful, don't forget to like, subscribe, and share. Until next time, take care.
Conceiving with PCOS, 20 tips for a successful pregnancy journey. 1. Introduction. Welcome to our channel. Today, we're discussing a topic that many women with polycystic ovary syndrome, PCOS, face: how to increase the chances of getting pregnant despite PCOS. 2. Understand PCOS. Briefly explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the significance of adopting a healthy lifestyle, including a balanced diet and regular exercise. 5. Maintain a healthy weight. Highlight the connection between weight management and PCOS-related fertility issues. 6. Monitor ovulation. Explain methods for tracking ovulation, such as using ovulation predictor kits. 7. Timing intercourse. Offer guidance on the optimal timing for intercourse during the menstrual cycle. 8. Fertility-friendly diet. Suggest foods that may positively impact fertility for women with PCOS. 9. Stay hydrated. Emphasize the importance of staying hydrated for overall reproductive health. 10. Reduce stress. Discuss stress management techniques as stress can impact fertility. 11. Supplements. Introduce supplements like folic acid and inositol that may support fertility. 12. Medications. Briefly mention medications that may be prescribed to regulate ovulation. 13. In vitro fertilization, IVF. Touch on the option of assisted reproductive technologies like IVF. 14. Acupuncture. Mention studies suggesting acupuncture may aid fertility in women with PCOS. 15. Regular checkups. Encourage regular checkups to monitor progress and adjust strategies if needed. 16. Partners' health. Remind that male fertility is crucial and partners should maintain their health. 17. Educate yourself. Encourage women with PCOS to educate themselves on their condition and fertility. 18. Community support. Recommend joining online communities or support groups for sharing experiences. 19. Patience and persistence. Emphasize that the journey might take time and persistence is key. 20. Closing. Conclude with a message of hope, reminding viewers that many women with PCOS.
Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing.
C-Section Recovery Guide, 20 Essential Tips for New Moms. 1. Introduction. Start by welcoming viewers and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending post-operative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
Baby development at Fix. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of 1 chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of pre-eclampsia.